Are you one of the millions of Americans with seasonal allergies? Well, we're going to apologize in advance because this year could bring more severe symptoms, Dana.
I know.
I actually never have gotten allergies.
Oh, knock on something. Yeah.
And well, one of the likely culprits as to why your allergies may be more severe is climate change. Here's why. This is according to a new report from the nonprofit news organization Climate Central. In every region of the country, data shows that rising global temperatures have led to fewer days with freezing weather. So that's giving plants more time to grow and, yes, release pollen. By the way, what we call allergy season, scientists call frost-free days. So frost-free days are
not good
coming, Dana.
Yeah.
It's basically the period between the last and first frost of winter. So the higher the global temperature and carbon dioxide levels, the more plants respond, meaning more pollen, and in some cases, more pollen that causes allergies than in years past. Cue the itchy eyes, the uncontrollable sneezing, and the tissues.
Yep.
So to help break down how climate change can affect your health and how you can prepare for a more intense allergy season, we are joined by Louis Ziska. He is a professor of environmental health sciences at Columbia University. Also with us is Dr. Purvi Parikh, an immunologist and allergist with NYU Langone. Good morning to both of you. Lou, let's start with you. Is this the new normal? Are we just going to continue to see pollens and allergy season increase, or will it eventually plateau?
It may plateau, but it won't plateau anytime soon. Right now, we're looking at projected temperatures, longer frost-free days for the next 20 to 50 years. So we anticipate that this is the start of the curve, but it's going to continue at least for the next several decades.
And Dr. Parva, I said, I've had allergies, but there are people I know who say, not you, but for the first time, they're starting to experience them now. Why is this happening?
Right. With climate change, our pollen seasons are longer and they're stronger in a way because the rising carbon dioxide levels are making our plants become super pollinators. So we're seeing that the allergy season is increasing year by year. It starts earlier, ends later, and there's higher amounts of pollen in the air. And this can predispose you to developing allergies because that's essentially how allergies develop, that your immune system sees something enough and then decides to become hypersensitive to it.
Doctor, I'm going to stick with you for a second. What does it mean when someone has never gotten allergies? I don't have allergies. And how susceptible are we now to getting allergies with this increased pollen?
Right. So, never having allergies essentially means that, you never had any symptoms, itchy eyes, stuffy nose, coughing. And many people don't realize that allergies are the most common cause of asthma. So we see a lot of asthma attacks this time of year, too, which can be quite dangerous. So not only are we seeing people develop these symptoms for the first time, but even allergy sufferers who may never had asthma are now getting asthma attacks for the first time because of these longer pollen seasons and with the higher pollen counts as well.
And Lou, you studied how some of this pollen is more allergenic. What does that mean, actually?
When you look at a pollen grain, the bit that causes your allergies to respond is the proteins on the surface of the pollen grain.
Okay.
And so what we're seeing with warmer temperatures and with more carbon dioxide is that protein level is increasing.
So it just produces more pollen.
It's producing more of, not just producing more pollen, but producing more of the substance on the surface of the pollen that causes your immune system to react. So we're seeing that for oak and we're seeing it for ragweed.
Lou, can you just explain, if you know, why we have allergies? I mean, why hasn't evolution stamped that out?
Well, there would be,
it
not be a good idea because one of the things that you're exposed to are a number of different substances, different chemistries that can make you sick. And so what often happens is your body responds in a way to help you, but sometimes it over-responds.
So it's trying to push it all out.
Exactly.
Oh, wow.
And Dr. Parikh, what can we do to prepare and maybe better combat what we are facing right now?
Right. So what I always recommend to all of my patients is start your medications and those control measures early. So right now, March is the time, if you know that you're prone to springtime allergies, to start, your daily antihistamine tablets, your nasal sprays, eye drops. And if you're those individuals that are prone to asthma, make sure you start those controller and treatment medications now, because it's so much easier to control these symptoms if you're preventative and proactive rather than scrambling backwards.
So start
asthma still.
Doctor, I'm sorry. So start it before you start seeing those symptoms. Is that a good idea? Like start taking your Zyrtec before you start sneezing all over the place?
Exactly. So this is the best time to do it, because we do expect to see those pollens coming into the air in the next couple of weeks.
All right, Dr. Purvi Parikh and Dr. Louis Ziska, thank you so much for being here.
You're welcome.
I've been educated on allergies. It's people who suffer, it's awful.
It's really bad, and the eye itching has gotten worse, and if you wear contacts and your eyes itch because of allergies, you know how brutal it is.